Uh, we are going to discuss the questions. First of all, we will read the statement from the last. And why are we reading the statement from the last? Because when we read the statement from the last, at least we will be able to know that what the examiner is asking from us. The first thing is this: which of the following is the most likely diagnose? So the examiner is asking about the diagnose. So we will say that here the examiner is asking about the diagnose. Number 2, what is the question? A 14-year-old boy is brought to the emergency department because of severe lower abdominal pain. What is the age of the child? Is a 14-year-old boy. Number 1 is a 14-year-old boy. What is the complaint of the 14-year-old boy? Severe abdominal pain. Okay. Pain in the right groin region, nausea and vomiting for 2 hours. Right groin region, and the patient had nausea and vomiting for 2 hours. The patient had been playing soccer with friend and started experience pain while walking home. So it's a sudden yes. For example, he was first it was normal, but after playing the soccer, he sudden experienced the pain at the right groin region, and with the pain, the child also has the nausea and vomiting. He has never experienced similar symptoms before. He has no other history of serious illness and does not take any medications. He appears ill. His temperature is normal. Pulse is 90, which is normal. Respiratory rate is a normal. Blood pressure is a 140/80. Okay. Abdominal examination shows no abnormalities. The right scrotum appears mildly swollen. Okay, and this is severe tenderness on palpation of the scrotum that persists with elevation of the testes. There is a severe tenderness on palpation of scrotum that persists with elevation of testes. So if in this we will say that when we elevate the testes, the pain increase, the pain intensity increase. Stroking the inner side of the right thigh fails to elicit elevation of the scrotum. This is known as a cremastic reflex. Okay, now we are going to make our own question from this. What the examiner is asking? A 14-year-old boy present to you with severe lower abdominal pain with nausea and vomiting after playing soccer. And the right scrotum appear mildly swollen, and when upon examination, upon elevation of the testes, the intensity of pain is increased. Also, the cremastic reflex is a negative. Cremastic reflex is a, we will say it is a negative. What's your diagnosis? What you will think?
Torsion.
We will say it is a torsion of the testes. Why it's a torsion of the testes? In the torsion of the testes, guys, you have to remember 4 to 5 points. First of all, we will say that in the torsion of the testes, it is an emergency condition, it is an acute condition. Mean the child will present to you or the male will present to you with a complaint of the sudden onset of the symptoms. Number 1, severe pain with nausea and vomiting. And we can see in this patient there is also a sudden severe pain with nausea and vomiting. So first of all, we will say that in a torsion we will see sudden severe pain with nausea and vomiting. Okay. Number 2, the involved testicle will be elevated related to the another testis. So in this we will see that the testis is elevated. Number 1, 2, we will say that elevated testis. Number 3, we will say that when we lift the testis in upward, the pain intensity will increase. And in which condition the pain intensity will decrease? Anyone knows about this? It is a epididymoorchitis. And what is the name of the sign? This sign is known as a Prehan sign. The name of the sign is a Prehan sign. So we will say that intensity of pain will high upon elevation. And number 4, cremastic reflex will be negative. What's the cremastic reflex? For example, when if any patient present to us, we will just touch the cold substance or any substance to the inner thigh. When we touch to the inner thigh, then the same side of the testicle little bit go into the upward direction. If it's going, then we will say it is a normal condition. But if it's not going, then we will say it is a abnormal condition. So the answer here is we will say testicular torsion.